Welcome everyone. I would like to present you my PhD topic, which is the assessment of efficacy and safety of natural products in the evidence-based medicine. My name is Dorottya Bastidas-Gergő. I am a medical biotechnologist, and I am a PhD student in the Department of Pharmacognosy in Semmelweis University. My vision is that the evidence-based use of herbal products will be more widespread in the medical practice. And to achieve my vision, my mission is to provide scientific evidence for health professionals to facilitate their work and their evidence-based decision-making when applying herbal products. My specific goals are two projects for now. The first is a systematic review and meta-analysis, and the second is a protocol of a randomized clinical trial. So my first topic is the assessment of efficacy of peppermint on nausea and vomiting. Nausea and vomiting are common symptoms, but in several cases it can lead to severe consequences. So let me introduce you some of those cases. The first is chemotherapy-induced nausea and vomiting. During the chemotherapy, nausea and vomiting are the most common side effects. It can affect up to 40 to 80% of the cancer patients. And it is the major cause of patient dissatisfaction, which can endanger patient compliance and can lead to the termination of the chemotherapy. The second is the postoperative nausea and vomiting. Every year, around 75 million people have surgery, and around 1/3 of them experience nausea and vomiting postoperatively, which can be even up to 70 to 80% among high-risk patients. It can lead to decreased quality of life, increased rate of complications, and also higher hospital stay, which can come with a higher cost for the healthcare system. And the third is nausea and vomiting during pregnancy. Worldwide, around 70 to 80% of the pregnant women experience nausea and vomiting during their pregnancy. And if the symptoms are more severe, we talk about hyperemesis gravidarum, which can also affect the baby's health, for example, with low birth weight, low Apgar score, or preterm birth. And the pharmaceutical products in the market are not always have efficacy for treating the nausea and vomiting symptoms. Sometimes even they can cause even more side effects. And if you think about it, that for pregnant women, it is very limited what they can take. So there is a necessity for an alternative treatment. And we would like to investigate peppermint, as it is used traditionally, and it has some preclinical and clinical data supporting its use. So our aim is to examine the effectiveness of peppermint on nausea and vomiting symptoms, either as an add-on or a standalone treatment compared to placebo or standard treatment. Here you can see our clinical question and our PICO. I would like to work with 3 subgroups. In every population, we would investigate adult patients experiencing nausea and vomiting symptoms, first postoperatively, then due to chemotherapy, and also during pregnancy. The intervention is peppermint, the comparator is placebo or standard treatment, and we would like to have for the outcome to measure the effectiveness by the visual analog scale or the Rhodes index. And our hypothesis is that peppermint as a standalone or add-on treatment reduces the severity of nausea and vomiting symptoms compared to placebo or standard treatment. We conducted our systematic search in 5 databases. You can see here the results and also our final search key. And this is the flowchart of the selection. Finally, after the full text selection, we got 18 eligible articles. So I am right now at the data extraction part. My second topic is a protocol of a randomized clinical trial, efficacy of Elixirium timicompositum for adults and children with acute bronchitis. Acute bronchitis is an inflammation of the large airways of the lung, and unfortunately, there is a high antibiotic overprescription rates for the patients diagnosed with this disease. And for this, there would be a very nice alternative option to reduce the symptoms. So we would like to think that Elixirium timicompositum could be a nice option for it. It is a Hungarian herbal medicinal product, and it has also an antimicrobial activity, and also it has an expectorant effect too. and its active ingredient is thyme tincture. And our aim is to assess the clinical efficacy and safety of Elixirium thymi compositum to ensure its safe and rational use and to reduce inappropriate prescribing in treating acute bronchitis. Here you can see our clinical question and our PICO. We would like to work with two subgroups. The first is adult patient and the second is pediatric patients with acute bronchitis. The intervention would be Elixirium thymi compositum. The comparator placebo or standard treatment. The primary outcome is effectiveness by the bronchitis severity score, and the secondary outcomes would be safety and tolerability and necessity of antibiotic use. And our hypothesis is that Elixirium thymi compositum as a standalone or add-on treatment alleviating the symptoms of acute bronchitis compared to placebo. And we are now in the protocol drafting steps. We just started to plan this, so this is in a very preliminary stage. Our inclusion criteria would be children between 6 to 12 years old and adults between 18 to 70 years old with acute bronchitis. There would be several exclusion criteria like allergy to the active ingredients, hypersensitivity to the plants in the Lamiaceae family, or having asthma. And for the intervention, we would have two arms. The first is Elixirium thymi compositum, and the second would be a standard treatment, ambroxol syrup. Our primary outcome is improvement of bronchial symptom score, and the secondary is side effects and also necessity of antibiotic use. So to summarize my aims, I would like to submit my first project in May 2023 and my second topic in July 2023. Thank you for your attention, and for finishing, I brought for you a quote from Marie Curie. "Nothing in life is to be feared. It is only to be understood. Now is the time to understand more so that we may fear less." Thank you.
Very good presentation, thank you.
Thank you.
To the second topic, may you consider as an exclusion for adult patients, smoking or something? Or
Yes, it could be nice. For the first, as we have this preliminary, then in the prescription of the product, we just mentioned first those which are written in it. And of course, we will consider more exclusion criteria. So thank you for your idea. We will also consider that too.
Okay, because it's very often that these patients have bronchitis or something.
Yes, okay. You are right. Thank you.
Thank you.
Hi, thank you for your presentation. I'm Gabriella from the Immunology and COVID group. And I was just wondering about your first project. That have you thought about investigating vitamin B to ease nausea instead of peppermint? Or what is the reason that you chose peppermint over vitamin B, for example?
Well, yes, it's true that also they used to the B6 vitamin for the nausea and vomiting symptoms. But the thing is that it has to be used in a higher concentration, a higher dose. So it can be only applied by intravenous injection. And for that, we need the healthcare provider to add this. So we would like to have an option when, for example, a pregnant woman if feels the symptoms, can simply just take the peppermint oil and can inhalate it non-invasive ways.
I see there. Thank you.
Thank you. Thank you for your question.
Thanks, Dorottya, for the great talk. My question is about your second topic, and I've noticed you put for this Elixirium thymi compositum this Phono 8 label, but on the other sides and on actually shelves you can find Phono 7 labeled products as well. What's the difference between the two labels?
Thank you for your question. The difference is that in the new product, they removed from the ingredients ethidium bromide and orange tincture, because ethidium bromide is no longer used in this product because it's dangerous.
Does Elixirium thymi any side effects that is known?
Known. Yes, for example, it can have asthmatic symptoms. Because I am using my topic and recently I was sick, I tested the product, and I recognized that in my childhood I had asthma, and I started to feel the hard breathing of the product. But I bought the Phono 7 version, so I am curious that how would be the new version.
I would like to ask a short question just about this second project. That why would you like to exclude those children that are between 12 and 18?
Yeah, so we are at the beginning, so we just started to have a discussion with in Szeged with the otorhinolaryngologist, and they sent for us our first suggestions that how would they do that, and they gave us these. So till the progress report, we didn't have chance yet to discuss in details that how would be our ideas for their suggestions. So of course we also noticed this too, and in the next meeting with them we would like to ask them that what is the reason, or can we include those population too.